Hello everyone, welcome to Lolly Queen Zone. I'm Lolly. We are discussing UTI, urinary tract infection. Is any infection anywhere along the urinary tract? The urinary tract starts from the kidneys to the ureters to the bladder and then the urethra. There are two types, lower UTI and upper UTI. Lower UTI specifically refers to cystitis. Urethritis is treated separately as sexually transmitted infection, and then upper UTI is infection of the kidneys called pyelonephritis. Causes of UTI: blockage of the urinary tract anywhere at all by stones, kidney stones. If you don't drink enough water, and then there is formation of stones in your kidney, it can block any part of the tract and then cause you to get UTI. Abnormal bladder function that prevents proper emptying, or when you decide to hold your urine in, and then there is a valve between the urethra and then the bladder that prevents urine from the bladder from going back to the kidney. When this valve is weak, your urine is likely to backflow, causing UTI, more specifically pyelonephritis. When you are admitted to the hospital and then there is insertion of a urinary catheter, it's a foreign body, so it can introduce some infection into your urinary tract. Some birth control methods like the use of a diaphragm with spermicide can also cause UTI. Presence of an abnormal connection between the vagina or the intestine and the bladder can also cause UTI. In men, when there is a prostate enlargement, it prevents the emptying of the bladder. Or when there is infection of the prostate, the infection can ascend to the bladder to cause UTI. The most of the people who have UTI are sexually active, so sexual intercourse is also a known risk factor for getting UTI. Symptoms: the patient has fever, chills, and has the general feeling of being sick. That's malaise. The classic symptoms in adults are dysuria, that's painful urinating, accompanied by urgency, intense urge to urinate, frequency, urinating every now and then, and hesitancy, that's straining at micturition. The hesitancy, like they want to pee, but then they have to be straining before the urine comes. And there is a sensation of bladder fullness and lower abdominal discomfort, which is usually accompanied by these symptoms. Investigations: how do we know that you have UTI, or how do we confirm UTI? The symptoms alone do not point solely to UTI, so how do we know? The most certain way to test for UTI is by urine culture. However, urine is a good screening tool, and your doctor may request for a urine RE. He may also do a complete blood count to, know if the infection has migrated from the urinary tract into the blood or whatever. It just gives him a broad idea what he may be dealing with. Here are some facts. Okay, so let's dive into the facts. Recurrent UTI may be an indication of an underlying renal abnormality, whether the person was born with that abnormality or is acquired. So if the person continually keeps getting UTI, it kind of broadens your clinician's attention as to the fact that you may be having an abnormality in your urinary tract, anywhere from the kidneys to the urethra. In newborns and immunocompromised, UTI can lead to septic shock, then death. So their blood pressure drops so low and they can die due to the infection when the infection gets into the blood. Upper UTI can lead to acute kidney failure. Upper UTI, as I said, is pyelonephritis. When it's not treated well, or when it's left standing for a long time, it can cause scarring of the kidney and lead to kidney failure. You can reduce your risk of UTI by urinating right after sex and by having protected sex, because STD has also been found to cause a UTI. So after you've had sex, you can just wee wee right after, just to with the attempt of pushing out any bacteria that is trying to ascend into your urethra. UTI is more common in women than men because of their shorter urethra and the proximity of their urethra to their anus. That's why it is good that women wipe from front to back and not from back to front. Because if they wipe from front and back to front, they will be introducing bacteria from the anus or from the feces into their urethra, which can cause UTI. For the treatment, your doctor will prescribe antibiotics for you to treat your UTI. For the dietary supplements, cranberries has shown to prevent UTI because it prevents the organism that causes UTI from binding to the lining of the UTI of your urinary tract. Sorry. So UTI is not caused by one organism. It can be caused by different organisms, but the most common one is bacteria. Blueberries, vitamin C, rich compounds, and then plain Greek yogurt also help. So you want to include it in your diet when you are treating UTI, or you can just take it just to boost your immune system so that you don't even get the UTI in the first place. If you haven't watched my video on how to make yogurt at home, I'll leave it in the description box and you can check it out. Thank you so much for joining me. I hope you like this video, and please, if you do, kindly like it, comment, and